Hi everyone, it's Doctor Staci Whitman, and I'm here to show you how to use a Myo Munchee to help with thumb and finger sucking, as well as just to chat about thumb and finger sucking and the concerns we have with these habits affecting growth and development long term, and what we can do as a team to help guide your child away from the habit while understanding root causes of the habit itself. Non-nutritive sucking is normal in young babies. It encourages proper suck, proper swallow, and breathing patterns. Sucking habits can support emotional well-being by helping to release endorphins that help with discomfort and pain, aiding in the release of serotonin, which is also known as our feel-good hormone. This helps with focus, mental organization, and it can help a baby or child reduce anxiety and stress and simply just relax. Ideally, children should outgrow non-nutritive sucking habits by an early age, and often, if the habit persists, it can be a sign of other underlying physiological or psychological issues. In ideal function, our tongue should rest up at our palate, being suctioned up to the roof of our mouth, and this helps create natural palatal expansion. It also helps keep our lips closed and an ideal swallow, as well as proper nasal breathing, which is all known for better oral and systemic health. While a child cannot physically get their tongue up to their palate, maybe due to a tongue tie or a restriction, they will often compensate by sucking their thumb or fingers to stimulate those feel-good hormones and to create functional balance and potentially to even open their airway, shifting their jaw forward a bit to help open their airway through the action of sucking on their thumb. As many craniosacral specialists and chiropractors will discuss, thumb sucking is often a sign that children are trying to stimulate cranial movement and stability. While sucking is normal for the early phases of development and in infants and young babies, it is not part of an ongoing developmental process, and we should learn on our own how to self-regulate and have mechanisms to support us, such as our tongue resting on the roof of our mouth, proper nasal breathing, and proper lip closure. It is important to understand that our concern early on isn't the sucking itself, but it's actually the continued habit. A neural feedback loop is often created through this continued habit, which releases dopamine, which is a reward trigger. And then this further fuels and solidifies the habit deeper, making it harder and harder to quit. Many parents think the only concern with these habits is in regards to their children's teeth positioning and aesthetics, but it is so much more involved than that. We're concerned with your child's jaw, mid and lower face development, and actually that they are physically growing around their thumb and their fingers. This can cause asymmetries and malformations. This can lead to open bite, tongue thrust, cross bite, overbite, narrow palates, and it can lead to improper swallowing patterns, mouth breathing, sleep disorder breathing, speech issues, picky eating, social issues and insecurities, and long-term orthodontic issues. So as you can see, it's a pretty big deal. Finding the deeper root causes with a trusted provider is key, as many of these airway and myofunctional issues can continue into adulthood even if the thumb habit ceases to exist. While many children seem to drop these habits on their own at a young age, studies do show that up to 30% of children continue their habits to the age of 4 and beyond. If I could wave a magic wand and get these kids to stop on their own, I certainly would, trust me, but such is not the case. And so what do we do now? Getting to the root cause of the prolonged habit takes a team approach. This often involves pediatricians, pediatric dentists, ENTs or ear, nose, and throat doctors, oral myofunctional therapists, craniosacral and chiropractic practitioners, and behavioral specialists. Some root causes can be tongue tie, oral restrictions, mouth breathing, craniosacral and jaw relationship imbalances, narrow palates, and other airway issues or obstructions. I have an entire program and protocol utilizing positive reinforcement and gentle reminders at my office for younger children, but have found in older kids, and generally that means about age of 4 and above, those that can acknowledge the habit and who ideally want to stop themselves, that Myo Munchee is a wonderful tool to help kick the habit. Myo Munchee is a medical-grade silicone appliance, and it is used as a myofunctional tool that I have loved adding into my practice and offering as a strategy to help patients with these habits. We have the child keep the appliance with them at peak habit times. For example, when they're in the car, doing homework, watching a TV show, at bedtime, or reading. And we ask them, once they get that urge to suck, to place the Myo Munchee in their mouth instead. Some children even wear them on a string around their neck so that it's always with them. I found that to be very successful. I've also found huge success in this method with older children, as it not only provides a replacement for the habit, still quenching that need for dopamine and serotonin release, but it also is helping to retrain muscles and structures of the oral cavity to create improved tone, tongue position, swallow pattern, nasal breathing, and overall function. Also, chewing on the appliance itself naturally has this calming effect, again, as it helps to stimulate and release all those feel-good hormones, as I mentioned before. So it's a total win-win. While there are other strategies to help thumb sucking cessation, I often found that kids do really well with Myo Munchee, and we now suggest it as one of our first lines of habit elimination in older children. If you have a child with thumb or finger habit and are at the age where they want to stop and understand why it is ideal for them to do so, please check out myomunchee.com for more info and find a provider near you who offers this incredible myofunctional and habit eliminating appliance. It can set your child up on a path of success for better growth and for better breathing. I truly, truly believe it is a small device with a big impact. Good luck.